Now let's go ahead and demonstrate applying a dry, sterile dressing to an adult client's surgical wound. We'll assume the nurse has checked the provider's orders, screened the client for allergies, and explained the procedure to the client. The nurse assembles her equipment. She will need a towel or waterproof pad, a bath blanket, clean gloves, a moisture-proof biohazard bag, adhesive remover, a sterile dressing kit or the appropriate dressing materials, sterile drapes and the prescribed cleansing solution, tape, straps, or a binder, sterile gloves, and any other materials the provider specifies, such as ointment. Next, the nurse provides privacy and assists the client into a comfortable position that allows good access to the surgical wound. She protects the bed linens with a towel or pad. With the bath blanket, she covers the client appropriately, except for the area where the dressing is. She sets up the disposal bag for easy access, then washes her hands and puts on clean gloves. Gently she removes the existing dressing, applying counter-traction to the skin as she peels the tape away, all the while being careful not to pull on the sutures or on any drains. If the adhesive were to resist removal, she would use a solvent to loosen the tape. She places the removed dressing in the disposal bag without touching the outside of the bag and noting the characteristics of any drainage on the dressing. She then removes the clean gloves and washes her hands. Next, she assesses the wound so that she can later document her findings. She opens all sterile supplies and pours the cleansing solution into a sterile basin. She puts on the sterile gloves, then carefully cleanses the wound, following the provider's orders or the institution's policy. Note that she cleanses it from the area of least contamination to the area of most contamination, using one sterile swab, gauze, or cotton ball for each stroke. If this wound had a drain, she would cleanse it and the surrounding skin last. She dries the area completely with gauze pads. If any medication has been prescribed, she would apply it. If this wound had a drain, she would apply pre-cut gauze around it, extra gauze below it, and add dressing material over it to collect drainage. Next, the nurse applies the sterile dressing over the wound. For larger wounds, the final covering is usually an abdominal pad to absorb drainage, support the wound, and protect it from trauma. Finally, she secures the dressing with tape or straps. If the client has fragile or sensitive skin, she'd be sure to use paper tape. After changing any dressing, you'll remove your gloves and dispose of them in the proper receptacle. Make sure the client is comfortable, then wash your hands. Document your dressing change, your assessment of the wound, any drainage or fluids on the dressing you removed and their color and odor, any wound care you provided, how the client tolerated the procedure, and any other concerns or observations in the client's record. Some institutional protocols also require that you put the date, the time, and your initials on the new dressing so that there is no question about when it was last changed.